Good morning. Welcome back to Open Med School. Today we will be discussing about physical examination, the general examination in medicine. Usually we say the mnemonic pickle, A for appearance, P for pallor, I for icterus, C for cyanosis and clubbing, L for lymphadenopathy and E for edema. We can add S also, that is stigmas of or signs of other diseases like liver disease, infective endocarditis, collagen disease, etc. So even though we are writing in this format, examination is a little different. We will be discussing the method of examination. In general, start with you should know about the patient, see that the identity is correct, examine from the right side of the patient. For a left-handed student, it may be a little difficult, but practice like that. After the general appearance, that is the way in which the patient is entering, you may be able to identify certain disease like hyperthyroidism, acromegaly, gigantism. All these things can be identified by the entry of patient into your consultation room. So you can say that the examination starts by the time the patient enters the consultation room. And when you are presenting, you should tell not only the positive findings but also the negatives. For example, if you are examining the hands and seeing that there is no clubbing, cyanosis or lymphadenopathy, you should positively mention like this: there is no clubbing, no splinter hemorrhage, no leukonychia, and this should be applied for examination of other parts also. This is the first thing I would like to tell in general. Now going to the introduction, how we will start the examination. So first you should introduce yourself. You should tell, I am so and so, I am a third year medical student or a final year student, and see that you are washing your hands. So remember this by wipe 3E. W stands for washing the hand. So either you should have a sanitizer with you or in presence of the patient you should wash your hands. Then introduce yourself, as I already told you. Explain what you are going to do. That is, I am going to take the history, I am going to examine physical examination, or I am going to take your blood pressure, and other things are there. So give a brief introduction to what you are going to do. Then ask the permission of the patient. It can be implied permission, but always better. So I am going to do this, okay, shall I do it? Something like that you can do. Then the position of the patient. Normally you will examine the patient at 45 degrees, that is the ideal one. But if the patient is very sick or in patient is having severe breathlessness, patient may be sitting, in such cases don't try to make the patient 45 degrees. You should examine with minimum discomfort to the patient. So that is about the position. Then privacy of the patient should be taken care of. So when you are exposing the patient, see that there is a curtain or only the necessary parts to be exposed. And whenever you are examining a patient different from your gender, see that there is a bystander or a chaperone should be with you, and adequate exposure. So this can be remembered by the mnemonic wipe 3E. So which already we have mentioned at the beginning. Now first impression is the best impression. So have a general appearance. So look at the patient and identify the general appearance. The first thing is whether the patient is really sick or not. So you should have a visual impression, and you should from the appearance you can say this patient is a young or middle-aged or elderly person who looks well or looks sick. So that should be the first impression you should make. Then you mention about the body build. So body build can be, simply you can say it as a thin person, obese patient, or moderately built, something like that you have to mention. Then think about the attachments to the patient. So patient will be connected to IV line, this oxygen supply may be there, there will be endotracheal, rails to catheter, etc. You mention about what are the connections to the patient. Then if the patient is obviously jaundiced or cyanosis, look at the color of the patient, and then as mentioned earlier, see whether the patient is in distress. So look for whether the patient is comfortable, is the patient is using accessory muscles for respiration, or the LNAC is working, or any evidence of pain. So that should be mentioned. and you can write down like this: the patient looks comfortable and there is no evidence of respiratory distress in the form of accessory muscles or respiration working. So next is you should tell about whether the patient is conscious and oriented. So this can be remembered by A, B, C to D, E. So remember A, B, C, D, E. So A for the appearance, B for the body build, C for the connections and color, and D for whether in distress, and E for the exposure, whether he is conscious or what about his higher functions. Have a general examination head to foot, or if the patient is sick, you go for the vitals. So vital signs are vital, and they are the pulse, respiratory rate, temperature, blood pressure. And nowadays we include the SpO2 also, and you can include the pain also if you want. The respiration should be counted pretending that you are counting the pulse rate. That is very important. Keep your hands on the radial pulse of the patient. If you want, you can keep the hands of the patient on the chest, not your hand, and palpate the pulse. Pretend that you are palpating the pulse, and then you count the respiratory rate. So keep this in point. So once you have recorded the vital signs, even though we are discussing no pallor, sinus, etc., it's better to start with the hands, because most patients expect that you will be examining the hands first. So this is very important, and by examining the hands, by giving a shake hand, you will be able to see whether the patient is anxious, whether when the hands are cold and sweating, it is anxious, and warm and sweating, thyrotoxicosis. So many things can be identified by examining the hands by that is why it is very important to examine the hands. Again, this will be discussed in detail. The major things should be looked for are, in the hands, look for clubbing, splinter hemorrhages, leukonychia and choleonychia. So these are the important things you should look for, and this will be again discussed in detail. Then once you examine the dorsum of the hand, see the palmar aspect. In the palm, the most important thing you should look for is the palmar erythema, that is in liver disease. Then you should look for signs of endocarditis like oscillation nodes, JNV lesions, which are evidence of active infective endocarditis. Then pigmentations, the hands are hyperpigmented. It is suggestive of Addison's disease, or in our place, B12 deficiency. So pigmentation looking for, and in a patient with anemia, when there is a significant anemia, the hemoglobin is less than 8 grams, you will see that the palmar creases are equal color of the palm. Then look for the debutant's contracture, the contracture of the palmar aponeurosis, which is evidence of, it can be a normal phenomenon in some people, or this may be an indirect evidence of liver disease, especially alcoholic liver disease. And think about the Raynaud's phenomena and ask about whether there is any history of Raynaud's phenomena for the patient. So you examine the dorsum of the hand, now you examine the palmar aspect. In addition, look for any joint abnormalities or any other obvious wasting, deformity also should be mentioned. So the dorsum will be examining mainly for the muscle wasting. I have mentioned about the clubbing, the claw hand. Then again pigmentation, any skin lesions, scars, tendon xanthomas. Most important, thinking about the flapping tremor. So ask the patient to keep the hands, outstretched hands like this, and if there is a inability to maintain the sustained posture, what happens? We are asking the patient to keep the hands like this, the hand goes down like this. So it is a negative myoclonus, and is classically seen in liver disease, but it can occur in respiratory disease, many neurological conditions, and respiratory failure. Then look for the fine tremor. Ask the patient to keep the hands like this. When there is a fine tremor, this can be due to hyperthyroidism, or the patient may be taking sympathomimetic drugs, or maybe due to anxiety. So that is the importance of looking for the outstretched hand and looking for the tremor. Then, so once you examine the hands, now it is a good time, if you have not recorded the vitals, record the radial pulse. Again, radial pulse should be examined ideally for 1 minute, and then take the blood pressure, and along with this think about counting the respiratory rate, pretending that you are counting the pulse rate. Once you are done like this, you can now think about inspecting the head of the patient. You should look for the shape of whether the size is big. Is more important in case of pediatric patients. The scalp should be examined. Look for the hair. and any abnormal swelling, anything, you should look at the head of the patient. Then looking at the eyes, you can either examine the eyes first or then look at the mouth or whatever it be, you can do it. So the eyes, the very important thing, the most one is looking for jaundice. Examine the sclera, ask the patient to, or keep you should draw like this and ask the patient to look upwards and preferably examine in daylight. While examining like this, you can look for the pallor, jaundice, cyanosis and polycythemia. All these can be examined at the same time. Then ask the patient to look downwards and see whether there is any yellowish discoloration of the sclera, because the jaundice is better identified by asking the patient to look upwards and look downwards and examining the sclera. Then along with this, look for pallor of the conjunctiva, which is a sign of anemia. Look for xanthelasma. Xanthelasma are patches of yellow skin around the lower or upper eyelids. This can be a sign of hyperlipidemia or primary biliary cirrhosis. And now it is time to look at the face and mouth. So many diseases, the facies, abdominal facies can be identified. If you are not observed specifically during the appearance in the beginning, now look for the abdominal facies. Then look at the mouth, whether patient has got a features of cyanosis, and if the mucosa is bluish in color, definitely you will think about the central cyanosis. And we'll look at the oral hygiene, the dryness of the mouth, any lesions in the mouth, and any abnormal cell like a fetal hepaticus or uremic fetor or the smell of cigarette. All these should be identified. Now look at the neck. In the neck, you should look for mainly the thyroid, trachea, pulsations and lymph nodes. Along with think about the salivary glands also. So the examination of this will be discussed in detail in another session. The lymph nodes are very important. All the lymph nodes should be examined systematically: submental, submandibular, tonsillar, parotid, preauricular, postauricular, occipital, cervical and supraclavicular. In addition, think about the epitrochlear nodes, axillary nodes and inguinal nodes. So examine the lymph nodes carefully. Along with it, you examine a general survey of the skin also. Look for abnormalities in the skin like pigmentation, any spider angiomas are there, scars are there. So any bleeding manifestation like purpuras, petechiae, all these should be examined. Now just look at the chest and see whether there is any gynecomastia, any abnormalities in the skin over there, and then the abdomen, see whether the abdomen is protuberant, whether any dilated veins are there, just a general survey, and then now go to the lower limbs. The most important thing in the lower limb you should look for is one is the pitting pedal edema. Whether there is edema is there, if the edema is there, you should identify whether it is unilateral, bilateral, tender, non-tender, pitting, non-pitting. We will discuss in detail how to look for the edema and the pathophysiology of development of edema. All the peripheral pulses in the lower limb should be examined, and look for changes in the nail. Whatever you examine the upper limbs, you should look for in the lower limbs also, and look at the joints and muscles, any deformities in the. These are the minimum things you should do in the general examination. General examination is a head to foot examination. So that is why you are starting from the head and ending in the foot. And then look at the sacral edema, because many times the pedal edema is present only in those who are walking around. Somebody is bedridden, it is a sacral region, is a dependent region. So you should examine the sacral region for sacral edema. Either along this or when you are examining the back of the patient separately, remember to look for the sacral edema. Now it is time to thank the patient and ask the patient to wear the coat, and then explain to the patient what you have found. If it is relevant, you should tell, okay, I have found something. So depending upon the situation, you have to explain to the patient also. Hope this was useful to you. The next session will coming out with the details of individual examination and the various physical findings.